Hello, let me give you one simple hypothetical situation that you diagnosed a case in which you felt that you will go for class 2 restoration. It's nearby to pulp but not very much into pulp, and you feel the clinical signs are not there and you feel that we should go for class 2 restoration, and you explain it to the patient and you just explain that we'll go for restoration and you went for the restoration, and somehow the pulp is exposed, the patient is in pain or in sensitivity. Now you have to change the treatment plan in between, and you're explaining it to the patient, but patient is not ready to accept it. Patient is feeling deceived, patient is skeptical about you. So how will you do this kind of communication to the patient to convince him or her that we have to do this, right? So lesson number one, I always insist that please learn the communication part. Communication is not a single line system. It's something which is layer by layer system, which is like building, creating a building. The first base is important. The second base is important. In this situation, the first base was weak. Why? You have to inform to the patient prior that this can happen. That means when you are diagnosing a case, take your time, check out the x-ray, see what all can go wrong, and in a very good and very subtle language, you have to explain it to the patient that, sir, this is the chance, this is what we are going to do. But if the pulp is being exposed or during the excavation we don't know that microorganisms are till the pulp or not, till you have to use, firstly you have to use layman language. Rule number one, you have to inform them that, see, that is near to nerve, right, and we'll go for the cleaning. We have to clean all of it, then only we'll place the restoration, the filling in layman language. But during that process, if the nerve is disturbed, then we have to go for root canal. If nerve is open, we have to go for root canal. First point. Second point, this is something which you will inform about the change of treatment plan during the treatment. You have to inform them about after the treatment also. That means you have to inform them that, okay, after that when we'll clean it, we'll place the restoration, but there can be chances of pain after the treatment, right? We cannot predict, maybe in 2 months, maybe in 2 years, maybe in 2 days, maybe in 2 hours. So there can be chances. Why? Because when we'll restore it, it will be near to nerve and it can press the nerve, it can disturb the nerve, right? And it can get sensitive or painful. In that scenario also we have to go for root canal. So you have to be ready about it, right? And in the future, if it happens, always end the conversation with a positive note with the management. You have to inform them that, okay, this can go wrong, but we can fix this, right? This is not in our hands because this is a 2D image, the x-ray. We can obviously give you the best diagnosis with the help of that, but treatment plan can change during the treatment or after the treatment, right? And you don't have to say that in every case. You should have that expertise that in which case you have to inform them, because the complexity you can easily see that it's near to pulp or not. So it's very important in endo part specifically that you should know where to talk, what to talk, how to talk, and where to stop. In this prior conversation will help you to avoid any rift, any confusion, and patient will trust you more. Patient will trust you more for the treatment planning. Patient will trust you more for the decision making, and you will be confident about your treatment planning also. So this patient will be yours. This patient will feel that this doctor is honest. He told me every information I needed or every information which is important, right? And I'm in safe hands. So I hope this works, this helps, right? So always talk to the patient prior, but in good language. Thank you so much for listening. For more such videos, you can obviously contact us, you can obviously follow us, you can obviously subscribe us. Thank you so much. Have a wonderful practice. This is Dr. Sagar Chaudhary. Thank you.